I would like to present my research, monofocal versus enhanced monofocal intraocular lenses, a comparative study supervised by Dr. Fuad. Disclaimer, there is no funding or conflict of interest to disclose. As we know, cataract surgery is one of the most common procedures done worldwide. And in recent years, it has evolved into a refractive procedure in which the implanted intraocular lens plays a key role in achieving the desired postoperative visual outcome. So the patient expectations has been increased, and there's a variety of intraocular lenses from standard monofocal to enhanced monofocal and multifocal intraocular lens, but not all patients are eligible for multifocal intraocular lens with increased incidence of photic phenomena such as glare and halo. As we know, the distant vision is important in everyday life and in outdoor activities, but intermediate vision has become increasingly important as increased use of computers and handheld devices such as mobile phones and tablets, also for seeing the car dashboard while driving and seeing the price tags at the supermarket. Our study was a single-centered observational retrospective cohort study, and data were collected between March and September 2022. Patients over 40 years of age with uncomplicated bilateral cataract surgery with no other ocular pathology has been included. 20 patients, 40 eyes, was implanted with Alcon Acrisoft SA6080 intraocular lens, and 20 patients, 40 eyes, implanted with Tecnis Eyehance by Johnson & Johnson. Alcon lens is a spherical, more strongly curved anterior than posterior surface, while the Tecnis Eyehance has altered aspheric interior surface of the optic that provide a continuous power profile with no rings and no zones. Both are hydrophobic acrylic with 6 mm diameter of the optic. The A constant for the SRKT formula that we used in our study, 118.4 for the Alcon SA6080 and 119.3 for the Eyehance. Here you can see the power map difference between the standard monofocal of Tecnis one piece and the Tecnis Eyehance. As you can see, the change in the central 15% surface area of the Eyehance that to provide a continuous power profile, a modified aspheric interior surface of the optic. While the correction for the keeping the correction for the spherical aberration unchanged as the periphery remains unchanged, and by the naked eye the Eyehance is indistinguishable from the Tecnis monofocal lens. After 1 month from the second eye surgery, the post-operative spherical equivalent approached emmetropia in both groups, for the Alcon group and the Eyehance group, with no significant difference between the two groups, and this shows that both lenses are efficient for spectacle-free distant vision. Here are the visual acuity outcomes for far at 6 meters and for intermediate vision at 70 centimeters and for near vision at 40 centimeter. As you can see, the Eyehance group shows better visual acuity for monocular and binocular uncorrected intermediate distance and distance corrected intermediate vision, and also monocular and binocular uncorrected near vision, while there was no significant difference in the binocular distance corrected near vision, with the partial improvement of the monoocular distance corrected near vision for the Eyehance group. For far vision, there was no significant difference. This is the defocus curve. Defocus curve, it is used by using defocus lenses from -1 to from +1 to -4 with a 0.5 incremental step to simulate vision at different distances. The blue line represents the Eyehance, while the orange line represents the Alcon group, and as you can see, the Eyehance group presents smoother curve with better visual acuity from minus -0.5 to -4, and this indicates that the eye hands may be more forgiving in residual refractive error post-operatively. Many studies have shown that depth of focus may be affected by the total spherical abrasion of the eye. So we measured the total spherical abrasion by using eye trace. Although Alcon group shows higher total spherical abrasion, but there was no correlation of the spherical abrasion with the monoocular uncorrected vision for far, intermediate, or near. Binocular contrast sensitivity with distance correction was comparable between the two groups, with no significant difference between the two groups. So this indicates that the changes done on the interior surface of the enhanced monofocal lens will not affect the distance optical quality. At the end of the follow-up visit, patients were presented with the validated visual function 14 questionnaire with the Arabic translation. And this is targeted for everyday life task. As you can see, it is a subjective assessment of the visual outcome. Now, patients with eye hands show little or no difficulty in achieving near and intermediate distance tasks, such as reading books, seeing stairs, and watching TV from an intermediate distance, and cooking. These photos represent the photos were shown to the patient at the end of the visit to assess the presence of photic phenomena such as glare, halo, starburst, and our study shows there was no difference between the two groups, and patients didn't have photic phenomena or were not bothered by it. As a conclusion, both monofocal and enhanced monofocal IOLs are excellent for spectacle-free distant vision, with better intermediate vision for the enhanced monofocal and partial improvement in near vision. Contrast sensitivity and photic phenomena was comparable between the two groups, with better subjective vision for intermediate and near distances. These are recent published studies that was also comparing monofocal to enhanced monofocal intraocular lens, and their results were similar to our results. And thank you for listening.